Welcome to Annapolis Mosaics. Our program spotlights people in our community who are involved in activities designed to promote good human relations. I am Michael Keller, the chair of the Annapolis Human Relations Commission and your host. The commission is a city board that seeks to promote equal opportunity and to eliminate discrimination. My guest today is Vincent Demarco, who is president of the Maryland Citizens Health Initiative. Vinny, welcome to Annapolis Mosaics.
Thanks, Mike, very much. I'm honored to be here with you.
Well, let's start by asking if you would summarize for our viewers what the mission of the Maryland Citizens Health Initiative is.
Well, we've been around since 1999, and our mission has been to achieve quality, affordable health care for all Marylanders. And I'm happy to say that we've made substantial progress in this state. There's been a lot of progress, of course, since the Affordable Care Act, but even before that, we expanded health care to hundreds of thousands of Marylanders here. And we funded that through some wonderful public health measures to increase the tobacco and alcohol taxes, which have also reduced teen smoking and underage drinking in our state. So we've made some tremendous progress, but there's a lot more to go. So that's our mission. We made progress. We need to do more.
Okay. Could you provide some detail in terms of your history? You said you began in 1999.
Right.
How have things developed since 1999 in terms of your organization, in terms of what the organization is?
Well, when we came together, a group of us devoted to achieving quality, affordable health care for all Marylanders, and former Baltimore City Health Commissioner Peter Bielenson was our founder. And we came together thinking, how can we do this in Maryland? And this was soon after the attempt by former President Clinton to achieve a health care for all plan didn't make it. So there was a lot of talk, let's do it at the state level. And we brought a group of experts together from the Johns Hopkins Bloomberg School of Public Health who spent a few years coming up with a smart plan for Maryland. And when that plan was put together, we built a powerful coalition of hundreds, if not a couple thousand organizations, faith, community, labor, healthcare, and business groups from one end of the state to the other to support that proposal. And then we brought it to the General Assembly. And there began a several-year-long debate where our whole plan was never adopted, but different parts of it were. And I believe our plan helped to influence the Affordable Care Act. And then we, of course, worked to implement it here. I mentioned earlier the tobacco tax increases. We have, over the last few years, increased the tobacco tax 3 times. In Maryland, and each time it's caused some tremendous drop in smoking, particularly amongst young people. Maryland has had over 30% drop in smoking in the last 15 years, double the national average, 40% drop amongst teens, much more than nationally, and it's because of these tobacco tax increases, which have also brought in hundreds of millions of dollars to the state, which even before the Affordable Care Act helped to expand health care to hundreds of thousands of Marylanders. And this has been great for all Marylanders because, you know, we all benefit when lower income people who can't afford health care coverage get covered. Because if they go to the hospital and can't pay their bill, we all pay through uncompensated care and unreimbursed hospital care. One expert organization says that of all our insurance premiums, about $1,000 a year goes to pay for health care for the uninsured. So we're all better off thanks to these health care expansions. And we want to thank Speaker Mike Bush and Senator Astle from Annapolis because they supported these measures. Speaker Bush took a leading role in enacting the 2007 tobacco tax increase, which saved lives and expanded health care. I want to tell you a story because we believe in stories, and our website, healthcareforall.com, is a good way for people to see what we've done in these stories. After that law passed in 2007, we held a series of press conferences across the state, including right here in Annapolis with Speaker Bush, in which we highlighted people who benefited from our healthcare expansion. And I'll never forget a woman in Western Maryland, in Garrett County, who told us how she had for years not been able to get access to healthcare. Her husband worked full time. She was raising kids, trying to do the best she could, but she couldn't get healthcare. Desperate, she went to the local health department and said, "Can you provide healthcare for my children?" And they said yes. And under this new law that she didn't know about, which former Governor O'Malley had just signed, she was able to get health care for herself also. She was thrilled. She got a Medicaid card. A few weeks later, she started feeling very ill. Had she not had that card, Mike, she would have tried to sleep it off, as many uninsured people do. Luckily, she had that card, so she went to the doctor. And her doctor said to her, "Thank goodness you have this card. You were developing something that would have killed you. But because you have this card, we're able to save your life." So she came to our press conference in Garrett County and said to all of us there, "Thank you for saving my life." And I've passed that around to the community leaders in Annapolis and across the state who supported our proposal. That comes from hundreds of thousands of Marylanders. And again, I want to emphasize, if she had not had that card and had tried to sleep it off, she probably would not have died right away. She probably would have gone to hospital, run up a huge bill, passed away. Could her husband have paid it? Almost surely not. We would have paid it. So this has been a big plus for Maryland, our successes.
Well, that's powerful testimony, Vinny. And you made reference earlier to a coalition. Could you describe the coalition that you have built over the years and how you work with its members?
It's an excellent question. We believe strongly in working through coalitions. And we have, as I said, hundreds of faith, community, labor, business, and healthcare groups who believe in what we're doing and work with us. For example, the NAACP. The NAACP is a strong supporter of our work, and they endorse it statewide, and each of their local chapters supports it. So when we're trying to enact, say, a tobacco tax or an alcohol tax, the local NAACP chapters contact their legislators, and that helps a lot. Same with AARP, same with the Medical Society and many others, and faith organizations. But we also work with them in other ways. When the Affordable Care Act passed, one of the most important things was to make sure that everybody who's eligible knows about it. Because many times you pass a law like this and people don't know about it and they don't sign up. So we work through our coalition to make sure that all of their members know there's now the Affordable Care Act. If you're below a certain income, you get free care and Medicaid. If you're above that, you get subsidized care. And that helped a lot to expand access to health care in Maryland through the Affordable Care Act. So our coalition is both an advocacy tool for us. It's a way we move legislation, and also a way for us to help them get their members enrolled in healthcare and in other ways find out about what can help them.
Yeah, about how many organizations are part of this coalition?
The latest is over 750 from one end of the state to the other, including many right here in Annapolis and Anne Arundel County. And 100 of them are statewide groups. I mentioned faith groups like the Baltimore Washington Conference of the United Methodist Church, a very strong supporter, Jewish community, and groups like the Ecumenical Leaders Group, which is all the top Christian leaders, the Baltimore Jewish Council, others. They come together because they believe in both our advocacy goals as well as our work to spread the word about healthcare that's available for people.
That's very impressive. How do you engage such a large coalition to maximize its effectiveness?
It's a very good question, and it takes some great staff who we have working with us. And it also is very important to listen.
Okay.
When people in your coalition have concerns, have ideas, to incorporate that in what we're doing. And we make maximum use of the statewide organization. I mentioned the NAACP. We have a tremendous relationship with Gerald Stansberry, who's the head of the Maryland chapter of the NAACP. And we stay in close touch with him, and he helps us reach his 23 local chapters. Same with the United Methodist Church. Bishop Marcus Matthews is a big supporter of ours, and we talk with him and his key staff, and through him, all of the hundreds of United Methodist churches around the state get the message. So when you work closely with coalition partners, you can accomplish a lot.
And how does the coalition interact with lawmakers, with governors, with other elected officials that you have to interact with?
Well, they are people who are very, very important in talking with legislators and other policymakers. Let me talk about the faith community in particular. We really focus a lot of our attention on the faith community. And there are 4 ways that the faith community helps to move legislation and influence policymakers. One is just their own personal clout. Mm-hmm. When they speak, policymakers listen. Policymakers believe that faith leaders have an important role to play in advocating for public health and other social mm-hmm. justice policies. I remember Bishop Doug Miles from Baltimore came in here, quoted some scriptural passage that mm-hmm. really moved legislators on why it was important to reduce teen smoking and save lives. And I think that was a big part of our success. Second, they provide a major way of reaching people in the grassroots. Mm-hmm. When you want to get a lot of letters mm-hmm. to a particular legislator, no better way than the social justice committee mm-hmm. of a local church or a mm-hmm. synagogue or a mm-hmm. mosque to get together and write the letters. Third is diversity. It mm-hmm. builds powerful diversity, political, racial, economic, mm-hmm. to build your coalition. And fourth, frankly, Mike, is the media. The media really likes to cover faith leaders mm-hmm. taking on these big causes. Mm-hmm. Sometimes it's like a David versus Goliath mm-hmm. battle versus the tobacco companies or the alcohol industry. I'll never forget, we had this press conference of top faith leaders calling for our first major tobacco tax increase, and the head of the United Methodist Church at the time said that he wanted to kick the butts of the tobacco companies. And he was livid when that wasn't in the paper. But what was in the paper was the head of the Lutheran Church saying that for centuries the Lutherans had made fun of the Methodists for getting all upset about tobacco. Bishop Moko said, "I'm here to say the Lutherans were wrong and the Methodists were right, and we're here to work together for this tobacco tax." And the headline was, "Clerics back tobacco tax increase," and the icon on TV that night was something like God versus tobacco. So that kind of message really helps. So I believe that our success with the tobacco tax, with the alcohol tax, with the healthcare expansion is largely because of this coalition with the faith community playing a critical role.
Mm-hmm. Well, we're going to take a break now, but when we return, I will be talking with Vinnie Demarco about some of the recent successes that the Maryland Citizens Health Initiative has had, as well as some other issues related to affordable health care.
I'm Major Ed Polito, United States Army retired. We had just finished a mission, and as I was driving, I hit an IED. I experienced post-traumatic issues related to the experience, and then when they took my leg away, I actually thought about taking my life. What changed was I began to reach out for support and to think about all these things need to be talked about. And so I began my recovery and to see that my life wasn't over and that I could conquer my challenge.
We're talking today with Vincent Demarco, who is president of the Maryland Citizens Health Initiative. Vinnie, what are some of the key successes that your organization has had in the past few years in enhancing the access of citizens to quality, affordable health care, and in other aspects of your work?
Well, I think one of our biggest successes have been the 3 or 4 times when we've raised the tobacco tax. And this chart here, Mike, shows that over the last 15 years, we've had a significant drop in smoking in Maryland. As I said earlier, 32%, double the national average, saving 70,000 lives. But as you can see from the chart, the big drops happened when the tobacco taxes went up, which shows that it's that price increase which keeps kids from smoking, which encourages adults to quit. And the money raised from that tax, hundreds of millions of dollars, has gone to expand health care to people like the woman I spoke about earlier, whose life was saved. So this has been a tremendous success, but we're not done. And as you can see from the chart, since our last cigarette tax went up, the smoking rate is kind of leveled. We need to do it again. We need to raise that cigarette tax again. That's why we've got over 750 faith, community, labor, healthcare, and business groups organized to raise the cigarette tax by another $1 per pack, which would save tens of thousands of more lives and raise another $100 million that can be used for public health needs. And our polling shows overwhelming support amongst Democrats, Republicans, and Independents. And just this year, 3 Republican states, Nevada, Louisiana, and Kansas, with Republican governors and overwhelmingly Republican legislatures, passed substantial tobacco tax increases, which I think demonstrates this is not a partisan issue, that we could do this even in a state with a Republican governor and a Democratic legislature. So that's why we're really pushing for another $1 increase in a cigarette tax, which we hope will happen in 2016.
Okay. One of the issues related to health care that's on everybody's mind is the Affordable Care Act, aka Obamacare.
Yes.
How's it working in Maryland?
Well, we have definitely had problems at first, and everybody remembers the problems with the website when it first came out, and that was bad. But despite that, we've now expanded healthcare to over 500,000 people, and I want to commend Carolyn Kotraki, who's the head of the Maryland Health Commission, for the work she has done to make sure that that system is in place. And the new health secretary, Van Mitchell, has also been working hard to make sure the new system works. He's head now of the Maryland Health Exchange Board. The two of them together are really working hard to make sure this works, and it is working. Over 500,000 Marylanders have gotten insured under the Affordable Care Act, either on Medicaid or private insurance with subsidies often, and the system works. So if you go on the website, you call the number, you can get the health care you need. And MarylandHealthConnection.gov is the website. We helped to promote that. We had a radio ad with Adam Jones from the Orioles that worked very well to get people enrolled in the healthcare. So we're very pleased with where the Affordable Care Act is in Maryland.
Okay. You know, some citizens have found themselves overwhelmed by and lost in the healthcare system. It's become pretty complex. What has your initiative done to help these individuals?
Well, we've done all we can to direct them to these navigators at the local level. There are 6 connector entities in Maryland. The one that handles Anne Arundel County is called Healthcare Access Maryland. It's based in Baltimore, but handles Anne Arundel County. They're very, very good. And they have people who are trained to help someone one-on-one when they can't figure out how to do the website. It's not their fault because it can be complicated, but there are people out there who can help. And what we do is we go through our coalition to make sure Marylanders know about these connector entities and these navigators.
Right. You know, you talked a great deal about your efforts in terms of raising the cigarette tax, but you've also had a campaign in the alcohol tax as well.
Yes, yes.
So could you share that story with our viewers?
Yes, I will, and I'm happy to do that. The alcohol tax that passed in 2011 was the first time the alcohol tax had passed in 40 years. And it was very difficult to do, but we did it because we showed the public and the legislators that increasing the alcohol tax, like increasing the tobacco tax, would have an independent public health benefit. And the tax has been doing that. It has been reducing underage drinking in the state, and the money raised from it went to help with school construction at first, but now it's going toward helping people with developmental disabilities, helping people with mental health issues, and helping people who have drug and alcohol abuse problems. So it really was a tremendous public health benefit, and to expanding health care. So that alcohol tax in 2011 was a tremendous public health victory for the state of Maryland, and I think that it shows that these public health revenue measures, tobacco and alcohol taxes, work. They're good policy and good politics.
You gave a really good story earlier about the woman in Garrett County who was affected, and I'm sure you've got other stories as well. And you know what I'd like to do is to spend a little time here putting a human face on the efforts by talking about some of the program stories that you have. Do you have anything that would relate to, for example, young adults?
Yes, absolutely. We've had one of the benefits of the Affordable Care Act is allowing young people to stay up to age 26 under the Parents' Health Plan. Actually, we kind of led the way in Maryland. We were among a few states who made it allowed kids to stay on their parents' plan up to age 25. I have a 22 and a 25-year-old, so I'm thrilled about this, as many Marylanders are. And now, up to age 26, you could stay on the Affordable Care Act and stay on your parents' plan. We did a lot to promote that by press conferences at colleges all across the state to let kids know about it. And we heard story upon story of young people, like a woman, Suzanne, who said she just couldn't find health care and she desperately needed it. And she was thrilled when the Affordable Care Act passed that she was able to stay on her parents' plan for a couple of years. And during that time, found a job that allowed her to get full health care benefits. But the point is, so many of the uninsured have been in the past young people coming right out of college, and it's hard to get that first job be one that provides you health insurance. So having this time on your parents' plan while you're getting that job has been a godsend to many, many young people in Maryland and across the country. And we heard story after story of young people who said, this has helped me in this transition period.
How about for small businesses?
Well, small businesses also benefit a lot because of the tax credits that are in the Affordable Care Act. And again, we did that first here in Maryland. In 2007, under former Governor O'Malley, we passed the Small Business and Working Families Health Care Act. And that provided the up to age 25, the expansion of Medicaid, and substantial grants to small businesses. And one of them is a gentleman named Jamal Bryant in Laurel. Jamal Lee in Laurel. And Jamal told us how he was really desperate to find how to get health care for himself and his employees, which included his wife. Well, with the passage of the Maryland law and the Affordable Care Act, he had the wherewithal to get health care for himself and his employees. And it turned out to be great. And a few months after he got enrolled, his wife had a serious illness. And thanks to the health care they had under the Affordable Care Act, she got the health care that she needed. And I'll tell you a great story. We were talking about Jamal at this press conference with Peter Francia. Comptroller Peter Francia was helping us spread the word about the small business tax credits. And also at that press conference was Elijah Cummings, Congressman Elijah Cummings, who was a leader in getting the Affordable Care Act passed. And he knew Jamal and his father. And so it was like a reunion at our press conference, and we were all just so impressed by Jamal's just really inspiring story of how the Affordable Care Act saved his wife's life and helped to save his business. And we know thousands of businesses from across the state have benefits. So these tax credits are there and available.
And how about for mental health improvement?
Well, under the Affordable Care Act, mental health is treated in the same way as other kind of health issues. So when you get the Medicaid coverage or the coverage under the private insurance, you can get mental health coverage just the same as if you break your leg. So people have that full coverage.
And how about for senior citizens, especially as it relates to low-income senior citizens getting discounts on prescription drugs and the like?
Well, again, Maryland led the way. Speaker Bush and Baltimore Delegate Pete Hammond, who's chair of the House Health Committee, led the way before the Affordable Care Act in enacting a measure to give substantial discounts to seniors. And Care First Blue Cross Blue Shield helped with this, to help seniors have reduced prescription drug costs if they're lower income. The Affordable Care Act, one of the main things it does is it closes that donut hole people may have heard about, which is if you have prescription drugs as a senior, Medicare paid it up to a certain point, then didn't pay, and then paid again. But in that in-between time, you were on the hook, and that was very hard on seniors. But the Affordable Care Act is closing that donut hole. And over the next few years, it'll be a lot easier for seniors to afford their prescription drugs. Now, this is not a panacea. There are still hurdles for people, but I can tell you, Americans and Marylanders are much better off now than they were before. We have the lowest uninsured rate that anybody can remember in America and Maryland, thanks to the Affordable Care Act. And I want to emphasize again for your listeners, we all benefit. When people have insurance through a Medicaid or private insurance, they are not adding a burden on hospital care that we all pay for.
What is next on the agenda for the initiative? What are your future plans?
Well, our immediate goals are a couple. One is to continue to fully implement the Affordable Care Act, to work with the Maryland Health Connection and Department of Health and Mental Hygiene to make sure every single Marylander who is eligible for care under the Affordable Care Act gets it. If you're really low income, you could do that anytime and sign up for Medicaid, which is great. Above that income, you got to wait till the next enrollment period, which begins on November 1st. And at that point, if you hadn't gotten insured already, you should, and we'll continue to get that message out. And secondly, as I said earlier, we would like in the 2016 session to enact another $1 increase in cigarette tax, which will continue to reduce teen smoking and provide the money for tobacco prevention and cessation and to help the Medicaid and health programs. So those are our two primary goals. And we also have another goal, and that is to work with hospitals to make sure that they can work together with the community to keep healthcare costs low. And we're actually working on something to get hospitals and faith communities and other local groups working together to keep people healthy once they come out of the hospital, to reduce readmissions and reduce cost of hospitals. So we're very busy, but what I want to emphasize this is we've made tremendous progress in Maryland over the last few years. There's more to go, and we're going to do it.
Okay, I'm sure that many of our viewers are going to want to learn more about the Maryland Citizens Health Initiative. How can they contact you? Could you provide your website?
The website is best.
What is the website?
Healthcareforall.com. www.healthcareforall.com.
It's all one word.
All one word, and all of our contact information is in there, and we're happy to talk to anybody. And if you go to that site, you'll see all the groups that endorse the Healthy Maryland Initiative. If you haven't yet, you can do it on the website.
Okay. Thank you for viewing our program today, and please join us again on Annapolis Mosaics. If you would like more information about the Annapolis Human Relations Commission, please jot down the information that's on your screen. You can reach us by phone at 410-263-7998 or by email at hrcommission@annapolis.gov. Or check out our page at the City of Annapolis website. Go to www.annapolis.gov, click on City Government, Boards and Commissions, and then you'll see the Human Relations Commission listing on the site. And always remember the words of Dr. Martin Luther King Jr., who said, "We have flown the air like birds and swum the seas like fishes, but have yet to learn the simple act of walking the earth as brothers and sisters."